The member from Simcoe-Grey.
Thank you, Speaker. My statement is directed at the Minister of Health and Long-Term Care, and it concerns the need for an expansion of the Collingwood General and Marine Hospital. Mr. Speaker, the government has left the hospital's expansion application in abeyance for more than 7 years. Regrettably, this neglect has serious consequences for local health care. The hospital cannot sustain clinical programs on its current footprint. The emergency room is grossly inadequate and doesn't meet the standards for a hospital that serves 32,000 ER visits each year. There is simply no more physical space to uphold the outstanding level of care provided by local doctors, nurses, staff and volunteers. They have already moved the administration into modular buildings and knocked down walls to expand capacity. Thanks to the support of the hospital's foundation and the County of Simcoe, the old administrative offices have been turned into an endoscopy suite, and renovations are also being done on operating rooms, the sterile processing department and the dialysis unit. Despite the hospital's best efforts, there are no more broom closets that can be turned into hospital rooms. They can't add another dialysis machine to meet local demand because there's nowhere to put one. In 2011-2012, the government is projected to spend over $1.4 billion on its health capital program. That's money already being spent across this province. Collingwood General and Marine Hospital only needs $1 million of that allocation to get started. Then they need to be put into the queue and be given the green light to move forward. Mr. Speaker, we're not asking for new money. We're simply asking for our fair share. I urge the government to respond to the needs of patients in Southern Georgian Bay. Thank you.
Thank you. Statement.